trying to talk without it bouncing back at you. Can people hear me?
Yeah.
Okay, all right. So if you consider a healthcare system as having two components, one is the payer, the one who collects the money and pays the bills, and the other is the provider. That's the hospitals, the doctors, the nurses, everyone who provides a service. So when we talk about single payer, in our current system, we actually have multiple payers. They're called insurance companies. They collect the money for healthcare and they pay the bills. With single payer, there is one payer, a public insurance pool where the monies are deposited and the bills are paid. Medicare is a single payer system. It runs on administrative costs of 3%. The private insurance companies' administrative costs are 30% and higher. And the Affordable Care Act was going to rein that in. It was supposed to be like 20%, but I don't think they've done a very good job. So that's a lot of money for a middleman who doesn't contribute anything to actual health care. I mean, I don't know about you, but I had a business and I would never pay my bookkeeper 30% off the top to keep my books. And that's what we're doing with the insurance companies. So I just want to be, excuse me. The private insurance companies' administrative costs are 30% and higher, so that's, I said that already. That's a lot of money for the middleman. But in fact, those costs, that money covers lobbying for the insurance companies, exorbitant CEO salaries, and profits for their investors. So just to be really clear, single payer is not socialized medicine. Socialized medicine is what the UK has, where the payer and the provider are all run by the government. We have VA. The doctors and the providers are paid by the government. That's not what we're talking about with single payer. We're talking about publicly financed, privately delivered. That's really important because a lot of the people who are against single payer want to scare you that the government is going to take over your health care, and that's not what it's about. Okay, so this is something that I put together to try to make it simple to understand single payer, and what I decided to do was pick 3 singles. It's not just single payer, it's also a single plan. In our current system, every insurance company has a multitude of plans, each with their own set of billing codes. In California alone, there are 6,000 health insurance products. That's different policies that you have a choice of buying. And every one of those products has their own set of billing codes. So in a single payer plan, there is one plan, one set of rules for everyone. And the paperwork and the billing time would be reduced by 2/3. The doctor would have more time to spend his resources with the patients on actual health care rather than on bookkeeping and fighting with insurance companies. A national health insurance program would save approximately $150 billion on paperwork alone. That's according to PNHP. It's a very good website you should get on. It stands for Physicians for a National Health Program, PNHP. Now, the last single that I wanted to point out, and this is like the most important, I think. I mean, absolutely, the payer is important. But here's the other thing, a single risk pool. In our current system, our population is divided into different risk pools. We have Medicare for the old, Medicaid for the poor, etc. These programs are paid for with our taxes and comprise 60% of all healthcare spending. These risk pools are the costliest because they deal with the sickest and the poorest of our population, and benefits are decreasing as costs rise. Insurance companies get to cherry pick from the rest of the population, which is the healthiest and least costly, resulting in enormous profits for them and tens of millions without insurance. If we combined everyone into one risk pool, there would be enough money to go around to cover everyone with better benefits. As one risk pool, we would also have increased power to negotiate costs of pharmaceuticals and medical equipment, which would result in tremendous savings. All nations who use a single risk pool system cover all their citizens for half of what we spend. Okay? Now, this is where the public option comes in, or Medicare if you want it, whatever they want to call it. What this does, it divides the risk pool. For this to work, we need to all be in the same risk pool. Everybody has car insurance, right? Do you ask your insurer, well, does he have a good car? Is he a good driver? No, we all pool our money together so that when somebody needs it, it's there. And that's what we should do with healthcare. The Affordable Care Act was a Band-Aid for our healthcare system. It kept the insurance companies in charge. It's kind of like keeping the fox in charge of the hen house. And we didn't need a 3,000-page bill to reform healthcare. And this is what gets me. When Obama was going around talking about healthcare reform, he said, and I recorded it because I wanted to get it on tape. He said, the only way to cover everyone is single payer. And then he said something very disingenuous. He said, and that would be great if we were starting from scratch, but we're not starting from scratch. Well, excuse me, we aren't starting from scratch. We already have Medicare. So it would have been very simple, and I heard this on Bill Moyer, a woman named Marcia Angel. She was the publishing editor of the New England Journal of Medicine, and she said it would be very simple. Just incrementally lower the eligibility age of Medicare until eventually everyone was on it. Very simple. You know, it doesn't have to be complex. So I just wanted to go over the benefits of what single payer would give. Number one, universal coverage. Everyone in, no one out. Better coverage. No copays, deductibles, or caps. No denying coverage for pre-existing conditions. Coverage will also include dental and eye care. I know that seems amazing. Oh my God, that's so expensive, how can I afford it? That just lets you know how much money is being wasted right now. We can afford that right now if a third of it wasn't going to the insurance companies. Okay, greater mobility. You know, we talk about freedom in this country. How free are you when you're tied to a job because that's the only way you can get health care? That's not freedom to me. Your coverage would remain from job to job, or if you lose your job, you would still be covered. Financial security. Over 60% of all bankruptcies in this country are due to medical bills. And the amazing part of that is 75% of those people already had insurance at the time they got sick. I remember when I first bought my house and my mom says, you better have medical insurance because if you get sick, you don't want to lose your home. And 40 years ago, that was true. But not today, not the way the insurance companies have worked the healthcare system, so that you definitely can go broke even if you have insurance. You can lose your home. And that was researched by The Ohio University. It saves lives. An estimated 45,000 people die each year due to lack of health insurance. That's the Harvard School of Medicine study done in 2018. 45,000 people die each year because they can't get health care. Better patient care. Care will be decided by doctor and patient, not an insurance agent trying to save money by denying services. There will be no out-of-network. We're all in the network. We're all together. Public options can have very narrow networks. That's one of the problems with the public options. When I first got Uncovered California, they had this plan. It was an EPO. You know, you've heard of PPO, you've heard of HMO. This was an EPO. And what EPO meant was, with a PPO, if you go out of network, you're responsible for 50% of the bill. With an EPO, if you go out of network, you're responsible for 100%. And their network was very narrow. I lost my GP because she would lose money by accepting me as a patient. And then I had nobody to go to. There were 2 phone numbers listed for GPs in this area. And one of them never answered, and the other one I left a message, never heard from them. So I got on Chap-A-Day. And for 4 months I was on Chap-A-Day because they would take EPOs. After 4 months, they were so overwhelmed with all their Medi-Cal people that they stopped taking EPOs, and I was virtually without a GP. Now, I'm a very healthy person, and so I'm lucky that way. But even so, without a GP for weeks, I mean, I have sleeping pills I gotta take. I gotta have a GP to prescribe those. I felt like what everybody else who is without health care must feel.
I felt abandoned. I felt like nobody cared. Can you imagine? You know, it was awful. However, I do have to say that once the PPOs came back on the exchange, and my doctor did take me back, I saved tens of thousands of dollars with the Affordable Care Act. Now, I was one of the lucky ones. There were a lot of people who were very hurt by it, too. So, anyway, enough said about the Affordable Care Act. So, another big thing that people, you know, who want to scare you about single payer is the cost. Okay, I want to say that single payer is the most fiscally responsible healthcare system to have. Now, when I wrote this single payer simply stated that describes this, that was about 2006. And I wrote, savings of $400 billion annually will result by eliminating insurance companies' administrative costs. That was a study done in 2006. So when I was going to come to this, I decided, well, let's find out what we're paying today, right? Well, oh, and by the way, that $400 billion annually is 1/3 of what health insurance cost for the country. So it was $1.2 trillion was what we were spending in 2006 on health care. Today, we are spending $3.6 trillion. It went from $1.2 trillion in 2006 to 3.6 in 2019. That's 3 times, right? So now insurance companies are making $1.2 trillion. Just to quote, according to the National Health Expenditure Accounts, that's NHEA, the office estimates of total healthcare spending in the United States increased 4.6% to $3.6 trillion annually. So I decided to do a little number game with that number. At that rate, I calculated that over a 10-year period, we would be spending $46 trillion, okay? Now, why did I pick that 10-year period? Because the people who are against this want to scare us. They came out with these numbers. I remember when Bernie and Elizabeth were talking about this. And they said, ooh, single payer is going to cost $35 trillion over a 10-year period. 35 trillion over a 10-year period. Well, our current system is going to cost us 46 trillion over a 10-year period. And that leaves 1/3 of our society still underinsured or uninsured. Single payer covers everyone for less. I cannot stress this enough. It's going to cost less. I don't care what they tell you about how it's going to raise your taxes. The problem is that most people who get their insurance through their work, they have no idea what they're spending on health insurance. If they knew what they were spending on health insurance, when they found out their taxes would go up 3% or whatever, they wouldn't be so scared, because right now they're paying 15% in premiums, you know? So single payer is going to save money. It's not that we can't afford single payer, it's that we can't afford not to have single payer. Just so you know, that rate of increase in healthcare is going up faster than our GDP. So can we sustain that? No. Okay. The last thing I just want to mention is that forget money, forget all of that. It's about what's the right thing to do. I saw this wonderful thing. I would love for you guys to see this on YouTube. T.R. Reid is a journalist, investigative journalist, and he was paid by a publisher to put together a book called The Healing of America. And T.R. Reid gave a talk to the Commonwealth Club in 2009 when the health reform was being discussed. And he talked about his book. And what he found was the countries that were able to achieve universal health care for half of what it cost usually went with a one-size-fits-all health care plan. Like single payer, all in it together, everyone in, nobody out. And when he asked those health ministers why they chose a one-size-fits-all, they said, they gave 3 reasons. They said it's simpler, it's cheaper, and it's fairer. He said all the countries that he spoke to, once they decided that universal health care was the right thing to do, they made it happen. So my question is, what are we waiting for? And just one last thing, back to Nevada County Chapter of Healthcare for All. We believe healthcare, everyone deserves it. And so to that end, since we're tired of waiting for single payer to pass, we were responsible for bringing up the California Care Force to give our community actual health care. Dental and vision are so important, and the insurance companies pretend like it doesn't even exist. Leah said, you know, so many diseases are caused by bad oral hygiene, and so Healthcare for All believes that we not only need single payer, but we want to get healthcare for our community as often as we can, and we hope that we'll get the clinic back up here in another 2 or 3 years. And I hope eventually that we won't have to use clinics like that again. And Leah wanted me to mention that Healthcare for All meeting is happening the 20th.